Hi everyone. Only a few items to update you on for this short working week. Elective surgery goes up to 85% of usual capacity next week. It's been at 75% for the last 3 weeks. So this means more midweek bed block for us. So keep pushing with those referrals to Brighton and hospital and the home. We have over doubled our admissions to Brighton this month, but there are still a lot of potential Brighton admissions that are getting missed. Remember that even on quiet days when it might be easier to get an admission to Malvern, to consider Hythe or Brighton as an option. This saves us a Malvern inpatient bed for later in the week when we're more likely to need it. We've had increasing numbers of patients being admitted as G West patients, and it seems that the clinical and clerical process for this is getting bedded down nicely. I do want to highlight that these are not extra patients that we're trying to attract to the ED. These are patients that we would have had to look after at other times of bed block. But we now have a process whereby we can gain some additional revenue from these admissions, and we've also formalised how the medical fellow can help support these patients. And on that note, the medical fellow is only to attend to G West patients between midnight and 8 AM. This is to protect the night registrar who's working alone and to allow them to concentrate their work on new ED patients. Prior to midnight, patients who are admitted to G West are still the responsibility of the ED doctor, and this will usually be the ED doctor who initially admitted the patient. So it's my expectation that if a nurse has any issues for a G West patient prior to midnight, that the ED doctor assigned to the patient will address these issues. After 8 AM, the first port of call for the nursing concerns relating to G West patients will be the VMO under whom they are admitted. But if the VMO is not readily contactable, then the nurse will approach the morning ED doctor who has taken handover on the G West patients. We've had some feedback from patients this week who've said or implied that either ED medical or nursing staff have told them they get a private bed when admitted to hospital, when this is not always the case and those beds aren't always available. This obviously leads to dissatisfied patients and a difficult situation for ward staff to manage when the patients arrive to the ward and discover that they're in a shared room. So it's important we manage our patients' expectations. So please be clear with patients about private bed availability and try not to promise on something that we might not be able to deliver. Attached to the weekly update this week are the requirements for the Purple 2 doctor to stay back or be called back. Could I just ask that whenever you're rostered on to a Purple 2 shift, to check in with the consultant in charge prior to leaving a shift to ensure that no extra assistance is required based on these criteria. Finally, can you all have a look at the video link in Lisa's update about the My Health record? This is an invaluable tool that we have easy access to here at Cabrini, and I think we can utilise it more often. I hope that those of you who are watching the football on Saturday have a win for your chosen team. For those of you who are working on Saturday, I'll see you on the floor. Otherwise, I hope you all enjoy the long weekend, and I'll see you all next week.